I wanted to show you a comparison that I made with our results for major cardiac events after roughly 4 years. I wanted to compare our results with some of the better known cardiology studies that are out there. And let's look first at the box on the far right, which is the Lyon Diet Heart Study. And at the end of 4 years, 25% had a major cardiac event, heart attack, stroke, or death. Now, if we go to the box to the left of that, there's the natural history of disease from Columbia Presbyterian Hospital in New York City. And at the end of 4 years, 20% major cardiac events, heart attack, stroke, and death. To the box to the left of that, Bill Bowden's Courage study, 19.4%. Now, to the left of that, there we are, 0.6%, one patient of the 177. And really, and you think about it, if I was really honest about the categorization, since he was not really compliant when he went to China, he should have been in the non-compliant group, but nobody would ever believe you if you said 100%. But why is it that our results are so different? It's over a 30-fold difference, and that is we were treating the causation of the illness. That's where the emphasis has been, to restore nitric oxide. And there's been a basic covenant of trust ever since the days of Hippocrates that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly, today in cardiovascular medicine, that is very infrequently being done. Now, here we have all things. The same year, I wrote another paper, published in the Experimental and Clinical Cardiology Journal. The title of it was The Nutritional Reversal of Cardiovascular Disease Fact or Fiction. 3 case reports. Now, what possible business did I have writing up just 3 patients? Well, all 3 of them, I thought, were, as far as I was concerned, were grossly mishandled by present cardiovascular methods. This first patient, Bob Mercer, happens to be in Newfoundland, Canada. And at age 44, he had a small stroke because he had a complete blockage of his right carotid artery. And at the same time, he had such severe angina that they did find a wonderful surgeon in Toronto who would operate on him for bypass surgery, even though he had one completely blocked carotid artery to his brain. And the thing that was of interest is that was a wonderful result. And now he was about 69 years of age, but he was in trouble again. He had gained 40 pounds. He now was diabetic. He now had all of his angina all over again. He also had erectile dysfunction. And at the same time, he found that his one remaining carotid artery to his brain was now 90% blocked. Now, of all things to have happen at this point, his 37-year-old daughter had a heart attack. And during her convalescence, she found a book called Prevent and Reverse Heart Disease. And she said to her father, "Pop, we got to do this together." They did. And it was a year later that I got a letter from Bob Mercer who said, "I wanted to thank you for writing Prevent and Reverse Heart Disease. I've lost 40 pounds. My diabetes has gone away. My chest pain, my angina has gone away. My erectile dysfunction has gone away. And my one remaining carotid artery, which was 90% blocked when I started your diet, is now 67% blocked." And here is Bob Mercer, before and after. This happens to be Jim McNamara. It was 11 years ago that Jim had an opportunity to start being plant-based. He had first had a small stroke, and they operated on his right carotid artery, and it was a total failure. and never could get it opened up again. And then he began to get rather severe symptoms of claudication. And eventually they tried to do a sort of a angioplasty with stenting, and that was failed. So they tried bypass, and that one failed the first time. They tried it a second time, and it failed. And they was told you'd have to learn to get on with this limp and this pain and try these drugs. But his wife found out about our program. He came, and he's been wonderfully compliant. That was 11 years ago. He can walk nonstop. And he is so marvelously articulate about his experience that he's an integral part of our intensive counseling seminar, because Jim wraps up our session sharing his story, which is so powerful and so convincing to patients who wonder if this works. So in summary, there is no mortality from the diet. There is no morbidity from the diet. And the benefits improve with the passage of time. And there's no added expense because you got to eat. And most patients, once they've had a heart attack, sadly are walking around with literally the sword of Damocles hanging over their head, wondering, when is the other shoe going to fall? When do I get my next heart attack? Nonsense. You never have to have another heart attack. You can make yourselves heart attack proof. Now, switching gears, it's interesting that when 85-year-olds in Sweden and in the United States, by the time we're 85, 50% will have dementia. And it was Megan Leary and her team from the West Coast who were reporting at the stroke meetings in Miami in 2001, had looked up over 5,500 MRIs of the brains of Americans. And what they find, at age 50, you begin to see the appearance of these little white spots. These little white spots happen to be little strokes. And it's interesting, though. Here you are, age 50, big brain, tiny stroke, everything's okay. But bingo, before you know it, you're no longer 50. You're 60. 15 years have gone by, 15 more years of the good old American diet. And you find yourself saying more often than before, sweetheart, where did I leave the car keys? Well, you kind of get over that. Before you know it, bingo, you're now 75, another 15 years. So you find yourself saying, sweetheart, where did I leave the car? Well, you get over that. Now you're 85. You look at your beloved and you say, are you my sweetheart? I can't reverse that. You don't suddenly wake up at age 85 and find yourself with dementia. You work hard in all those preceding decades to lay the foundation of this dementia. Here for your review is a normal MRI of the brain, no problem here. But look at this, I counted 90 of these little blocks in this. Can you imagine a message trying to go through that scar tissue? Now, on the other hand, here, let's see if we can get, on the left, you see the MRI of a 40-year-old triathlete, the benefit of exercise. The right upper, you see a rather atrophic thigh muscle in a 70-year-old couch potato, 74-year-old couch potato. And then the lower right, you have the thigh muscle of a 70-year-old triathlete. Pretty impressive. And now here we go back to 1986. And on the left, you are looking at the pulse volume at the ankle of a 54-year-old gentleman who had a fair amount of heart disease, and in addition, had a partially blocked artery in his thigh, and in walking across the skyway to my office, had to stop 5 times because of pain in his right calf muscle. But I was so focused on his heart, I forgot all about his leg until 10 months into the study, one day he said, Dr. Esselstyn, do you recall when I first started seeing you, I was having to stop 5 times coming across the Skyway because of pain in my calf. He said, over the last month, it's gone away. It's absolutely disappeared. I don't stop anymore. So I said, John, back you go to the vascular lab. And now you look at the pulse volume at his ankle on the right, it is double what it was. And this was absolutely a eureka moment for us. We now suddenly had, early in this experiment in 1986, 87, we had absolutely irrefutable, rock solid scientific data that food and food alone could absolutely reverse cardiovascular disease. And I know many of you are going to say, well, wait a minute, what about the statin drugs? Well, I presented to you 2 patients today, one Dr. Crow, who refused to take it, and Don here. And this was in 1986. We didn't have any statins at that time. Here's another. This is a 78-year-old, a 78-year-old retired high school chemistry teacher. And in his retirement, he and his wife loved to do the square dance. They would enter these square dance contests, but it was during the fast square dance, he would get bilateral calf pain. So we ended up seeing several vascular surgeons who got the image you see here, but he didn't like the magnitude of the operation that they were proposing. And he came to see us and said, Dr. Esselstyn, if I choose your method, how long will it take for me to get rid of my calf pain? So I looked at him with great wisdom in my face. And I said, probably about 10 or 11 months. 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone.